Hello class and welcome to week 3. We are moving right along into module 3, which is specific common health issues facing vulnerable populations internationally. In module 3, our learning around vulnerable populations and global health is around health disparities and social justice and the common healthcare challenges that are faced by vulnerable populations. When we talk about health disparities, we think about every human has a right to health care, access to health care, to receive high quality care that is safe, that is affordable to them, and that meets also their cultural needs. As healthcare continues to grow and evolve, baby boomers are retiring and the patient populations continue to grow older. They are sicker and more chronic. Their medical decision making about their care is more complex. And we, as nurses and healthcare providers, are charged with developing more innovative processes to meet the needs and promote quality healthcare outcomes for our patients. As we look at our vulnerable populations from a global perspective, we know from a global perspective that priorities in health promotion and prevention include promotion of mother and babies, infants and children, their well-being, prevention and wellness, cardiovascular disease, as we mentioned before, quality access to care. Smoking cessation is a big one. Infectious disease, reducing the incidence of TB, malaria, controlling infectious diseases, and also the increasing need for mental health in our populations, in our communities, the lack of resources for mental health, or just the wait times in itself for patients to get in to see mental health providers, or having the knowledge to seek mental health services in their own community. These are just to name a few. As we look at global health, we also look at how we are accessing the population, their risk factors, their environment, such as things that they may be exposed to, and how we evaluate outcome. We also look at statistical data, which includes morbidity, mortality, infectious disease, and the number of people with disabilities or type of disabilities in our population, and how big the population is, how much it is growing. For this week, I want you to look at the global burden of disease, but I also implore you to read information and really think about healthcare inequality, the common causes of death and disabilities, and learn more about what type of health prevention programs are out there, not only from a local perspective, but what do we have globally to help vulnerable populations, and what resources are in place, and what type of health disparities affects our aging and older adult populations. For this week's discussion board, you will discuss your health promotion projects and you will post what you have done and worked on so far. Your peers will review this and provide you feedback to ensure that the information you're providing will meet your target audience, and also give you feedback about the content and whether there is culturally competent care involved in it. Your discussion board assignment is due this week as usual, but your health promotion project is due on the 18th. I wanted to share that when I worked in a practice setting and I was charged with doing a population health promotion project, I chose to do diabetes. And at that time, I chose to develop what we call a diabetes clinic day for our population. I worked in a smaller community hospital, and a majority of the patients there were, either low income or underserved. Not all of them. But it was such a privilege to work with these patients because they were so welcoming and they wanted the help. And what we did was we brought a group of patients together, we identified them, we risk stratified them, and used the data to bring in patients with A1C levels that was greater than 8 or 9. So the focus of these meetings were around diabetes complications, around the pathophysiology, around nutrition, pharmacology. And the way we promoted this to our patients and the way we engaged them is that we made it on a level of understanding for them. We used a lot of pictures, charts, and not to dumb it down, but at a health literacy level that was appropriate for them. We also allowed them to engage with each other. We brought in A1C champions, so people who experienced the process of diabetes and what did they do and how did they become successful in self-management of that disease state. And it really turned out well. We took them on shopping tours and taught them how to make food that they like using, substitutions for lower sodium, lower sugar, lower carbohydrates. The provider I was working with actually brought all the patients in and catered a luncheon for them that she made the meals out of the American Diabetes Soul Food Cookbook. So able to, bring them in, experience how the food could be cooked a different way, that it won't impact their blood sugars in a negative manner. So I just wanted to share that story. I do look forward to reading all of your health promotion projects. I must say that I'm still working on the grading for your learning experience, your service learning experiences, but I am totally really engaged in the information that I'm seeing from everyone. So have a great week, and as usual, if you have any questions or concerns, please reach out to me. You may use the Ask the Faculty tab in Blackboard or email me directly. Thank you all and have a great day.